team. And now your host, Dr. James Haney.
Thank you and welcome to the show this morning. The topic this morning is the Phoenix Healthcare Corporation, and we're fortunate to have with us to talk about the Phoenix Healthcare Corporation the president of the Phoenix Healthcare Corporation, Mr. Sam Howard. Mr. Howard, let me welcome you to the show this morning.
Good morning, Dr. Haney.
Mr. Howard, we're going to talk about the Phoenix Healthcare Corporation and related health care issues this morning. But before we do that, let's talk about Sam Howard. Let's talk about some of the things that led you to the presidency of the Phoenix Healthcare Corporation, and give us some information about your background, your education, and that kind of information. Then we'll talk about the establishment of the Phoenix Healthcare Corporation.
Sure. Dr. Haney, I'm an Oklahoman. I came to Nashville in November of 1973. But prior to that time, I'd received a bachelor's degree in business from Oklahoma State, a master's degree in economics from Stanford. I'd been a White House fellow in the Johnson administration and worked for General Electric. But Dr. Elam invited me to Nashville in 1973 to be vice president of Meharry Medical College. I stayed there for about 4 years and then went on and I was recruited by Jack Anderson to go to hospital affiliates. And that's where I went into the investor-owned hospital business and learning about running actually major corporations in the healthcare business. HCA acquired hospital affiliates in 1981, and I went to HCA as vice president and treasurer, and then essentially left HCA in 1989 as senior vice president. So that's my healthcare background. We've had about 21 years experience in the healthcare business, not only here in terms of the job, but nationally. I was involved with the Federation of American Hospitals. I was president of that association. I think it was about 1985 or 86.
What's this association?
All of the investor-owned hospitals in the United States belong to what's called the Federation of American Health Systems. It's basically the association which deals with the policy, legislative policy, studies of the investor-owned hospital business. You keep statistics on the occupancy, the profitability of all these companies. HCA was a member, Humana, all the major corporations were members. And I was the national president for a year. And in that capacity, I served on the first advisory committee on Social Security, which looked at the Medicare program back in 1982, which was a long time ago. But that's when we first examined Medicare from a national perspective, and I was the hospital representative on that panel.
And so you've got tremendous background in terms of dealing with issues that we're dealing with this morning, healthcare-related issues. Let's talk about the establishment of the Phoenix Healthcare Corporation and some of the things that motivated you toward the establishment of such a corporation.
Phoenix Healthcare was formed in February, I think, of 1993. Actually, a gentleman named Stephen Braden and I formed this company to take advantage of what we saw as opportunities in managed care in the Medicaid market. We incorporated the company in May. We filed for our insurance license in September, and we capitalized the company at that time. We wanted to build, and we're still trying to build, probably a $400 million company over the next 4 years. That's our target goal. If that can be achieved, that's going to be unusual for a company to start in Nashville from nothing. Actually, from literally 3 employees to now we have 50 employees.
Now, this is managed health care. Is that,
yes, this is managed care.
Now, exactly what does that mean? And for the sake of, for the benefit of our audience this morning, let's talk about from your perspective and from the background that you've given us dealing in health, let's talk about some of the various managed care plans and some of the things that are out there now that you think that our audience ought to be aware of. Let's talk about it from that perspective.
People, when they think about health care, usually think about what I call the fee-for-service method. They have an insurance policy with Blue Cross, maybe Aetna, Equitable, some other insurance policy that pays for their medical care, and they, the individual like you, Dr. Haney, you will go and you'll say, I'm going to go see Dr. X and Dr. Y, and then Dr. X will put you in the hospital over here with HCA or Meharry Medical College. You pick the plans and the providers that you want to go see. Well, in a managed care situation with Phoenix or Access Med Plus or Blue Cross has a managed care program, you will contract with us in Phoenix Healthcare. We will assign you to a doctor. and then we will manage you throughout the healthcare system so that you don't have to worry about the admission forms and all these other hospitals. We take care of all of the work of helping you throughout the system. All you have to know is we've assigned you one doctor who is your primary care physician, who is very knowledgeable about you, who keeps your medical records, and then every time he wants to move you throughout the system, he calls us, and we make sure that you have all your health care costs covered in every other aspect of the system. You don't have to know a lot about the system other than Phoenix and your doctor.
And so you, from an administrative point of view, you take care of all of the forms and all of those things that they would have, that ordinarily have to take care of.
All the forms and the bills. Everything associated with providing you the care that you need. Phoenix, for example, in Nashville, Tennessee, we provide you with good hospitalization, all the specialist costs, all the drug costs, all the pharmacist costs, and we even give you transportation to get to it.
Well, let's look at, from within that context, let's look at the healthcare system today. And to have you, again, from your perspective, to talk about some of the things that you consider to be significant in terms of the delivery of services, the payment for services, and essentially where the government might stand in there, not only the federal government, but also to think in terms of the TennCare system and to sort of, from that perspective, which is to say that you know that we're having a difficult problem in terms of creating a health care bill that everybody can deal with. From your perspective, what would be some of the ideal kinds of things that ought to go in such a bill? And from that, let's talk about it from that perspective.
Well, the healthcare system in the country represents about 14% of the total GNP. It consists of hospitals and doctors and pharmacy companies and everything else. And what you are seeing in the country right now is a gradual shift from what I'd call fee-for-service